low voltage QRS complex on ECG indicates? The options are pulmonary embolism, pericardial effusion, carpulmonale, and then the infective endocarditis. So what is the criteria to call it as the low voltage complex? So if the amplitude of the QRS complex, if it is less than 10 mm in the chest leads, and if the amplitude of the QRS complex, if it is less than 5 mm in the limb leads, this we call it as low voltage complexes. Among the options which has been given to you, the condition where you will have low voltage complex is in case of the pericardial effusion. Now, and at the same time, let me also show you the ECG of the low voltage complex. This is the ECG. So you can observe here very clearly that the QRS complex in the chest leads, it is less than 10 mm, and in the limb leads, it is less than 5 mm. Now, what is the reason why in patients with the pericardial effusion you will have low voltage complexes? Because of the presence of the fluid in the pericardial space, the electrical activity which is generated within the myocardium is not transmitted properly to the leads. Right? It is not being transmitted properly to the leads. So the electrical activity which is being picked up will be less in cases of the pericardial effusion, and thereby you get low voltage complexes. Then not only the pericardial disorders, we have some systemic conditions which will cause the low voltage complexes. Now what are those systemic conditions? We have the endocrine disorders. These endocrine disorders, they include number 1, hypothyroidism. Now, why hypothyroidism will cause low voltage complex is the hypothyroidism is one important etiology which will cause the pericardial effusion, and thereby the individual will have low voltage complex. Then the another important etiology is the adrenal insufficiency. So adrenal insufficiency is nothing but the Addison's disease where you will have low voltage complex. Okay. Then these are the endocrine disorders. Followed by that, the pleural disorders. The pleural disorders causing low voltage complex will be left-sided pleural effusion, right? Next, left-sided pneumothorax. So these are the two conditions, these are the two pleural disorders where you will have the low voltage complexes. Okay. Why? Because in patients with left-sided pleural effusion or left-sided pneumothorax, this pleural abnormality will overlap the heart, and thereby the electrical activity which is generated within the heart is not transmitted to the surface of the chest properly, and thereby you will have low voltage complexes in these pleural disorders. Then the lung pathologies. So what are those lung pathologies where you will have low voltage complex is in patients with the COPD. In chronic obstructive pulmonary disease, which particular subtype of COPD? That is emphysema. So in patients with emphysema, like what happens is you have large voluminous lungs, irreversibly abnormally dilated lungs. This irreversibly abnormally dilated lungs overlap the heart, and thereby the electrical activity which is transmitted to the surface of the chest will be reduced, and thereby you will have low voltage complexes. So the pulmonary disease where you will have low voltage complex is the COPD. Which particular subtype of COPD? That is emphysema. Then obesity. So in obesity you will have low voltage complex because more and more soft tissue, more and more fat that is overlapping the heart. When more and more fat is overlapping the heart, the electrical activity which is transmitted to the surface of the chest will be reduced, and thereby you will have low voltage complexes. And then in patients with anasarca. So in patients with anasarca, you know, the edema is there all over the body, even within the chest. So when there is edema even within the chest wall, the electrical activity which is transmitted to the surface of the chest will be reduced, and thereby you will have low voltage complexes even in patients with the anasarca, right?